Hi guys, the red color points which I have written here are very important for your USMLE and NEET PG, which I have taken from various standard textbooks. The yellow color background with red written on it will be for your UG preparations, 2 mark question, 5 mark questions. All the points have been taken from the standard textbooks. So for your exams, always you prefer writing in this order: definition of the terminology, introduction, epidemiology, etiology, pathogenesis, signs and symptom, complication, gross, microscopy or biopsy, lab, imaging, and treatment. So without any delay, let's get started. Lateral sinus thrombophlebitis, also called as sigmoid sinus thrombosis. First is definition. So you can see the sigmoid sinus being there. Okay, so when this sigmoid sinus, if it is being lodged with thromboembolism, we call that as lateral sinus thrombophlebitis. Introduction: it is one of the complication of your chronic suppurative otitis media, which is being caused by cholesteatoma. Okay, so pathogenesis is when it spreads into the sigmoid sinus, it forms a perisinus abscess, which activates the coagulation cascade that leads to your sigmoid sinus thrombosis or lateral sinus thrombosis. Every time when the thrombus is released into the blood, the fever just spikes. You can see the image which is being correct. This is called as picket fence fever or hectic fever. So once the thrombus, if it's being entered into the mastoid emissary vein, slight tender of your in the mastoid region where we will be having an edema. This is called as Gracinger's sign. So you have to differentiate this from mastoiditis. Suppose if it's being lodged into the internal jugular vein, other IgV takes up the function, where the other IgV is also compressed, okay, which leads to increased intracranial tension. This increased intracranial tension will be seen as crow beak sign as a papilloedema due to the compression of the normal internal jugular vein. Where in this lumbar puncture, it will be also seen as Tobey-Eye test. I'll be showing the images of them in the back. Okay, suppose when the thrombus is present in the superior sagittal sinus, it causes otitic hydrocephalus. Clinically, you will be having headache and vomiting, which is a sign of ICT, also known as pseudotumor cerebri or benign intracranial hypertension. So all pseudotumor cerebri, Tobey-Eye test, Crow-Beak test, everything is an MCQ. So we have a mnemonic called as PIC test. Okay, lateral sinus thrombophlebitis, we have a mnemonic PIC test. Picket hectic fence fever, ICP, Gracinger's test, Tobey-Eye, empty delta test, and grow big posture. We'll see what are they. Okay, so clinical features, you will be having pallor, headache, and hectic picket hectic hence fever. You can see the picket hectic. The normal baseline is 98.4, but during this fever, the fever will not be normal to the 98.4, but it will be reduced to somewhat level. Okay, this remitting fever will be looking like malaria, so you should be more careful. So Tobey-Eye Quirkenstedt test. Okay, so compression over the IgV on normal side increases the CSF pressure in the lateral sinus thrombosis. It's a very invasive test. Okay, next is in papilloedema, compression over IgV on the same side leads to engorgement of retina. You can see the engorgement of retinal veins, which leads like crow peak. Okay, on CCT or MRI, you can see the empty delta sign. You can see the delta like structure. So CT, you will be having a, this is your CT. In CT, you will be having a very thick bone mass. Okay, so this is your MRI. This is your MRI, and this is your CT. Okay, so in both you can see the delta sign, empty delta sign. Okay, the treatment is MRM or evacuation of the thrombus and IV antibiotics. Thank you.